Hello, professors from both Amsterdam and the US. This is team number 1, and in this presentation, we're going to take you through our analysis and our innovative suggestions for the business model of the company we decided to focus on, and that being Proteus Digital Health.
Proteus Digital Health is a company in the healthcare industry with estimated annual revenues of just under 25 million. Their first customer was Barton Health in 2016. They are now valued at around 1.1 billion, and their key products include the pill, which is ingested and works together with the patch to track your habits and send the information to the Discover app, which is for patients, and then the Discover portal, which the doctors use to track the patient habits. The focus of this presentation will be on the Discover portal, which we feel is crucial in innovating the business model of Proteus. In terms of the customer value proposition, the target customer is any healthcare provider. Problems with healthcare providers is that doctors can have problems with making accurate diagnoses at times. So Proteus aims to provide a digital solution that provides better insights, optimized therapies, and lower costs. Proteus' business model could use some improvement. In terms of content, doctors spend a lot of time on analysis, which is very time-consuming and costly. For structure, the information systems are currently disintegrated. For example, Barton Health is currently using Proteus technology for chronic health problems, but what if the same patient has a non-chronic issue? Then Barton Health put this information into their own information system, but not Proteus's. Finally, for governance, the focus of the organization could suffer because of the manufacturing of the product being done in-house.
Now, after analyzing their current business model, we came up with 3 possible innovative suggestions that they can incorporate, focusing on content, structure, and governance. We decided for our content suggestion that Proteus should create an anonymized database of past patient cases that doctors can access to compare to current cases in order to make a quicker and more efficient diagnosis. For our structure suggestion, we decided that Proteus should allow doctors to integrate all of their patients' information into the Discover portal instead of the specific information Proteus allows now, in order to make the portal a total information system for the doctors. Lastly, for our governance suggestion, we decided that Proteus should outsource manufacturing to a third party so that they can better focus on their core competencies, which is their highly innovative medical and technological research.
Our new business model suggests integrating all patients' data into the Discover portal. This collection of data would be made up of the data that is collected through Proteus' pill and patch combined with the input that the doctor provides, like personal details of the patient, for example age and gender. This means that the Discover portal becomes a healthcare provider's new integrated patient information system. We also want to add content innovation in the form of a big data analytics tool that works with the integrated Discover portal. This tool can then be used to summarize and create an overview of data that, for example, helps a doctor to quickly diagnose a patient based on past results of other patients. This innovation creates value to the 2 main parties involved in several ways. Firstly, for customers, this innovation allows for cross-examination from one source. It allows for predictive analytics like recovery paths compared to past results. It improves tracking of patient progress, and lastly, it can increase efficiency in patient diagnosis. For Proteus, this new and improved Discover portal can be marketed as a prominent tool for end users and profit from a network effect, since the more data is in the database, the better and more accurate the big data analysis tool works. Proteus can also create an additional revenue stream, for example, by selling user licenses to academic institutions for research purposes.
So, this new business model obviously brings some value drivers. To start with, the innovation brings something new to the customer, namely cross-examination of patient data, which results in faster diagnosis and its predictive abilities. Besides that, customers are likely to keep using this product, since switching from information system is not only a hassle, but also brings high cost. On top of that, the customer will lose the novel features, which results in longer diagnosis as before. The innovation is not a product in itself, but a complement to the existing products like the pill and the patch. Customers can choose whether they just want to use the existing products or they want to use this data as well. As mentioned before, the database will decrease the time spent on diagnosing patients. So with the same amount of doctors and the same time span, more patients can be helped or there can be more interaction between patients and doctors. All these things together will bring value to the new business.
In terms of generating revenue, our business model largely follows Proteus' existing business model. Proteus earns revenue from selling the pills and patches to healthcare providers, as well as from selling the right for healthcare providers to use the Discover app and portal. The app especially could be quite attractive for end users, so healthcare providers can compete by offering their patients the possibility to use it. However, we also found new revenue sources for Proteus to utilize with our innovation. For one, we suggest that Proteus charges its customers a subscription fee for access to the data analytics tools, as these are a beneficial complement to the existing Discovery portal. That way, Proteus will have the necessary cash flow to run the servers to host the data. And as mentioned earlier, Proteus would also be able to sell the bundles of anonymized data collected through its products and services for the purpose of academic research. Researchers could easily be able to filter out the data that they need for the purpose of their study, so it's a win-win situation. So that sounds great, but how does this affect our customer value proposition? Our new customer value proposition is to bring forward a new digital solution providing better insights, optimized therapies, and lower costs. You're probably thinking that sounds quite familiar, and you're right. It's the same customer value proposition from before, only we've managed to actually help Proteus fulfill these promises more effectively. For a more detailed description of this business model innovation, we invite you to read our executive summary. We also included some points of reflection regarding work in distributed teams, as well as some tips for those who are interested. Thank you for your interest in our suggestions for business model innovation for Proteus Digital Health.